Good morning. I call this meeting of the House Democratic Steering and Policy Committee to order. Welcome, everyone. This is a joint hearing with the Democratic Women's Caucus and the Reproductive Freedom Caucus. I'm Debbie Wasserman Schultz, one of the co-chairs of the Steering and Policy Committee. I'm proud to join my colleagues to expose Republicans' attacks on reproductive freedom. Excuse me. Tuesday marked 3 years since the Dobbs decision, where a Republican-controlled Supreme Court ripped away abortion rights from millions of American women. Over that time, we've seen the harmful impacts with women in 19 states now living under near or total abortion bans, including in my home state of Florida. Countless statistics illustrate the devastating impacts these bans have on women's health, including how women are twice as likely to die during pregnancy or childbirth in states with abortion restrictions. But it's the personal stories that truly expose the harm. Like Deborah Dorbert, a Florida mother who got the worst news a woman could hear at her 24-week ultrasound. Deborah's baby would not survive after birth. Her baby had Potter's syndrome, which meant he didn't have any kidneys. In the very same visit, she was told her only options were to go out of state to receive an induced birth abortion, or she could carry him to term knowing the baby would die and that she would be at risk of deadly complications. She and her husband couldn't afford to go out of state for care. So Deborah was forced to spend the next 13 weeks battling anxiety, depression, and debilitating pain, only to have her son die in her arms 90 minutes after his birth. Like millions of women living under abortion bans, Deborah was denied the fundamental right to make her own decision regarding her medical care. We had a chance to hear from Deborah at the first Steering and Policy Committee hearing on the road just a couple of years ago, and her story was searing. The pain and really grave situation that she was forced into because of the change in Florida law, which now has a 6-week ban, was inhumane. I just had two more Arkansas women share their traumatic abortion ban stories with my office this week. While actively bleeding out and at risk of sepsis, they were refused medically necessary care due to the state's strict abortion laws. To get the life-saving care they needed, both women were forced to travel out of state. Facing medical emergencies, both women called their Republican lawmakers for help to get care, but they were told to figure it out themselves. This cannot continue. It will never be okay that women in the United States are forced to endure lifelong trauma, all because Republicans want to control women's bodies and our doctors' offices. But these extremist Republicans won't stop at abortion bans. They also want to criminalize birth control and fertility care like IVF. That's why Democrats fight nonstop to block the far right's attacks on women and their right to choose whether and when to become a parent. And Democrats will not stop fighting, arm in arm, to protect America's access to vital health care, including contraceptives, fertility care, and abortion care. And, as if on cue, I will now yield to one of our best allies and champions in this fight, Leader Hakeem Jeffries, for his opening statement. Leader?
Good morning. Well, good morning, everyone. Thank you to our co-chair, Debbie Wasserman Schultz, and the distinguished members of the caucus who are here for their incredible and steadfast leadership. And of course, thank you to our incredible witnesses who have joined us here today to share your experiences and your expertise, including Alexis McGill Johnson, Dr. Hauser, Senator London Lamar, as well as Heather Martell. Thank you all. This week, of course, marked 3 years since the unconscionable Supreme Court decision in the Dobbs case, one of the most extreme decisions in the history of our country. We know right-wing conservatives and extreme MAGA Republicans want to prevent women from being able to make their own reproductive health care decisions, strip away contraception, restrict the ability to travel to receive health care services, and impose government-mandated pregnancies as part of their reckless march toward a nationwide abortion ban. House Democrats believe in a woman's freedom to make her own reproductive health care decisions, period, full stop. We believe it's a decision that should be between a woman, her family, and her doctors, no one else. We, of course, believe in a woman's ability to receive necessary, urgent, life-saving care, and that it should not depend on what state you live in or what the ideology may be of the extremists in government. And House Democrats, of course, will never stop fighting to prevent the effort to strip away reproductive freedom from the women of this country. To the contrary, we will continue to do everything we can to restore a woman's right to make her own reproductive health care decisions, and that is why great leadership from Judy Chu, we've reintroduced the Women's Health Protection Act, have made it one of our top legislative priorities, and we will not rest until a woman's right and freedom to make her own reproductive health care decisions is restored all across the land. So thank you all for your presence. I look forward to an enlightening hearing for the American people, and it's now my honor to yield to one of our incredible reproductive freedom champions in the caucus, my good friend and the chair of the Democratic Women's Caucus, the distinguished gentle lady from the great state of New Mexico, Teresa Leger Fernandez.
Thank you so much, Leader Jeffries, and thank you to our witnesses who have come here today to share with us firsthand what is happening across the country, from your personal story to the national concerns to what happens in a state like Tennessee. So as noted, I am chair of the Democratic Women's Caucus, and I represent Nuevo Mexico's beautiful, diverse 3rd District. I am thankful to the Reproductive Freedom Caucus and the Steering and Policy Committee and our leadership and all of the Congress people you see here who care so much. But I need to tell you, all of the caucus cares deeply about these issues because we know that a woman's freedom is also tied to a woman's health and her ability to live. New Mexico is the first state heading west from Florida that fully protects reproductive health care rights. It's not just a local safe haven, it's a national one. In New Mexico, we welcome women's rights refugees. And indeed, in New Mexico, 69% of the abortions in 2023 were provided to women from other states. Now, we in New Mexico not only recognize full reproductive health care, we use state funds to assist all the women who show up within our borders to access the care they need. But in places like Lubbock County, Texas, they are actually criminalizing a woman's right to travel to New Mexico to get the care she needs to protect her health and her life. Imagine, we now live in a country where there are jurisdictions that believe they can restrict a woman's right to move about, to imprison her in their state. Imagine. But New Mexico recognizes that that's not the right thing to do. And when we think about it, New Mexico is a land of many faiths. We honor our Catholic tradition. We are one of the states with the highest percentage of practicing Catholics in the country. We honor our indigenous religions, our Sephardi who have been there since, in the early 1600s, our Christians, and those who might not practice any faith. But we honor them by allowing women to make decisions about their own reproductive future and health and lives and livelihood in consultation with her own doctor, her own faith, and those she chooses to discuss this important decision with. And now we also want to remind us that Republicans have been plotting to strip women of their freedom for decades. The Dobbs decision overturning Roe v. Wade was an essential but not the last step of their obsession. And I am so pleased that the parliamentarian rejected their last effort to say we could not use private insurance to access abortion care, which would have impacted women in places like New Mexico. Because no one should fear for their life when they decide to start a family or decide not to start a family. No one should die because doctors fear legal action if they give care. No one should mourn the loss of a loved one because Republican politicians restricted their health care. The Democratic Women's Caucus and the Democratic Caucus in Congress will always fight for these freedoms because you cannot claim to be pro-life when your policies threaten the lives of women. I yield back.
Thank you. I'm Congresswoman Diana DeGette from Colorado, and along with my dear friend Diana Presley, we're the co-chairs of the Reproductive Freedom Caucus. And as you heard, 3 years ago, just a few days ago on Tuesday, the Supreme Court overturned Roe versus Wade, which ended a constitutional right that American women had for over 50 years. For us, Tuesday was a day just like any other Tuesday. It was a day where we fight like hell against the Republicans' assault on reproductive freedom. And we're going to keep doing it every Tuesday and every day until all Americans have the freedom that I have and that my daughters have and that I worry like anything that my granddaughter will not have. The devastating consequences of the Dobbs decision only continue to grow with time, and the GOP assaults on reproductive freedom keep coming, as Teresa mentioned. It's getting harder and harder in America to decide when and if to have children. And when American women do decide to become pregnant, it's hard to do so safely in many parts of this country. Imagine that's where we are in 2025. Mothers living in states that have abortion bans are twice as likely to die during pregnancy, childbirth, or soon after giving birth compared to mothers living in states like ours. More than 100 hospitals nationwide have shuttered their obstetric units since 2022. And now, of course, Donald Trump's big ugly bill would defund Planned Parenthood, slash Medicaid, which pays for half of all the abortions in this country, and he tried to ban abortion coverage in ACA plans. Teresa mentioned this, but I want to talk exactly about what this means, because it's something that they buried in the bill during the Rules Committee debate in the wee hours of the morning, and thank God my colleague here to my right found it and called it out. But this, we considered this when we did the ACA, and what this says is if somebody buys an insurance plan with their own money on the exchanges, those plans would not be allowed to offer coverage for abortions, even if somebody paid for it with their own money. And what that would mean practically is that insurance plans nationwide would just stop offering abortion coverage. And that's the true goal of the Republican conference in Congress. And we should never forget that as we fight for full access for all health care that people need. And I want to thank all of the panel for being here with us today. We continue to have to call out these issues, tell our stories, talk about what's happening to all of us. But it's my honor to introduce a dear friend of the Reproductive Freedom Caucus and a tireless champion for reproductive freedom. Alexis McGill Johnson is president and CEO of the Planned Parenthood Federation of America. and the Planned Parenthood Action Fund. She's been part of Planned Parenthood's leadership for over 15 years, and she's been instrumental in steering the organization through outrageous Republican assaults on reproductive freedom. We have Alexis as practically part of our team because we've worked so closely over the years and with advocates across the country for many, many years. I'm so happy you're back here with us today, and I welcome your testimony. Thank you so much.
Much, Congresswoman DeGette, for that lovely introduction, and it does feel in such a crazy time to feel at home here with such champions of reproductive freedom across the board. Thank you, Leader Jeffries. Thank you to the House Democratic Steering and Policy Committee, the Democratic Women's Caucus, and the Reproductive Freedom Caucus for inviting me to speak today, and to all the members who have just been fighting so fiercely for reproductive freedom. Tuesday marked 3 years since the Dobbs decision. 20 states now ban some or all abortions. Over 25 million women and more than half of all Black women of reproductive age live in those states. But Dobbs was just the beginning. The full spectrum of reproductive health care and Planned Parenthood's very existence are under attack. Before I explain the threats, I want to be clear about Planned Parenthood's role in the nation's public health infrastructure. Every year, over 2 million patients rely on nearly 600 Planned Parenthood health centers across the country for essential, trusted, and affordable health care, including birth control, cancer screenings, wellness exams, STI testing and treatment, and abortion where legal. Planned Parenthood health centers see everyone, no matter who they are, no matter where they live, no matter how much money they have. These health centers are a backbone of public health, and the data shows that no other provider could fill the gap they'd leave. But that doesn't matter to our opponents. Their goal is to end abortion in the U.S., so they are attacking sexual and reproductive health care from all angles. These attacks go beyond dehumanizing and harmful policies. They are spreading misinformation, defying the rule of law, and using horrific rhetoric that encourages political violence and emboldens bad actors. Almost 2 weeks ago, a suspect in Minnesota impersonated a police officer and killed State Rep. Melissa Hortman and her husband, and gravely injured Senator John Hoffman and his wife. Our hearts are breaking for these lawmakers and their loved ones. While the investigation is ongoing, reports are circulating that the alleged shooter's manifesto included abortion providers and reproductive rights advocates. It wouldn't be the first time that extreme anti-abortion beliefs fueled violence and intimidation. But instead of protecting patients and providers, we've only seen lawmakers escalate their rhetoric and dismantle legal protections. One of President Trump's first acts in January was to pardon 23 anti-abortion extremists who violated the FACE Act, a federal law that protects people from violence and obstruction when trying to access or provide reproductive health care. House Republicans recently marked up a bill to repeal the FACE Act, and President Trump's Department of Justice issued a memo saying they wouldn't enforce it unless there were extraordinary circumstances such as death. This is the environment patients and providers are navigating every day, along with a range of other threats. In March, the Trump administration withheld Title X funds from providers, including some Planned Parenthood affiliates, partially because of their commitments to DEI. To be clear, they're using every single opportunity to reinforce their belief that some of us just don't belong here. Already, multiple Planned Parenthood health centers in Utah, and Michigan have been forced to close. We're also waiting, as early as this morning, to see what the Supreme Court's decision in Medina versus Planned Parenthood South Atlantic. The decision could stop Medicaid patients in South Carolina from being able to go to Planned Parenthood health centers for care and greenlight other states to pass similar policies. And on top of that, the Republicans' reconciliation bill would defund Planned Parenthood. If it is signed into law, the impact would be devastating. Nearly 200 Planned Parenthood health centers could close across 24 states. More than 1.1 million patients could lose access to care. More than 90% of the health centers at risk of closure are in states where abortion is legal. The closures would eliminate 1 in 4 abortion providers nationwide. And that's why they're targeting Planned Parenthood, because Planned Parenthood health centers provide abortion proudly where it's legal. Make no mistake, Defunding Planned Parenthood is a backdoor abortion ban. The reconciliation bill would also gut Medicaid, which provides health coverage to more than 70 million people in this country. 1 out of 2 of our patients receive Medicaid. Think about what it would mean for millions of people to lose health insurance and for providers across the country to close. People will still need care, but won't be able to afford it or get it in their community. And I think for some people that may seem like an acceptable burden, but I can tell you no one wants to travel an extra 2 hours to deliver a baby or delay a checkup for that lingering health symptom that turns out to be cancer. We know what happens when people aren't able to get care. After public health precautions were lifted during COVID, we saw STI cases go up. People were able to get tested again. But that wasn't the end of the story. Some untreated STIs can lead to ectopic pregnancies, infertility, and other pregnancy complications. In 2021, syphilis rates increased by nearly 32% and resulted in 220 stillbirths and infant deaths. And the Dobbs decision has caused similar ripple effects. Abortion providers, medical students, high-risk pregnancy experts continue to leave states with abortion bans rather than risk the criminal charges or loss of licensure. And that means labor and delivery units are closing, maternal health deserts are growing, miscarriages and other pregnancy complications are going untreated. When you gut health care, entire communities suffer. I'm really grateful to all of the members here for your leadership and your continued support. Please keep using your platforms to highlight what's at stake and how your constituents are harmed by attacks on healthcare. And please keep fighting these cruel policies. Every lever you use to delay and defeat these attacks means so much for the patients that Planned Parenthood Health Centers serve. Thank you.
Thank you so much for your powerful testimony, Alexis. Good morning. I want to thank our steering and policy co-chairs for holding this important conversation alongside the Democratic Women's Caucus and the leaders of the Reproductive Freedom Caucus. It has been 3 years since right-wing justices, hand-chosen by Donald Trump, delivered their disastrous Dobbs decision, a decision that repealed Roe v. Wade and undid half a century's worth of progress. Today, extreme Republicans in state houses across this country have the power to criminalize abortion, punish doctors for doing their jobs, and put women's lives at risk. These attacks on women's health care have been met with fierce resistance, thanks in large part to the brave women sharing their stories and speaking out about life or death consequences of Republican extremism. It's my privilege to introduce Heather Martell of Chippewa Falls, Wisconsin. Heather has lived through the dangers of the Republican attacks on women's health care. In 2021, she and her husband were expecting a baby boy, Oliver. An ultrasound revealed Heather had severe medical challenges that were, quote, incompatible with life. Their family made the difficult and incredibly personal decision to seek an abortion. They had to travel across state lines to receive the care that Heather needed and deserved. Since the Dobbs decision came down, she has faced continued barriers, including worries that Republican laws in Wisconsin would make it harder to pursue fertility care in the form of IVF. Thank you, Heather, for sharing your story and your courage in the face of incredibly difficult circumstances. You're now recognized.
Thank you. Good morning. It's an honor to be here today. I want to thank Leader Jeffries, the Democratic Women's Caucus, Reproductive Freedom Caucus, and the House Democratic Caucus for convening and leading this hearing today. I also want to thank Free and Just for uplifting me and opening the doors for me to tell my story here today. It's great to see so many politicians here with F ratings from Susan B. Anthony Pro-Life America list. It makes me wonder how many women a congressman has to sell out to get an A+ rating, but I digress. It's been a childhood dream of mine to speak here. It deeply disturbs me that it's under these conditions. This is something deeply personal. The government infringing upon my rights as a citizen to privacy, autonomy, and hindering my freedom from government overreach by means of the dangerous and inexcusable Dobbs decision which overturned protections for abortion access granted by Roe v. Wade. Republican lawmakers have continued to push their extreme agenda through state legislatures, ripping away the rights of Americans everywhere to privacy, autonomy, and freedom from government interference. I felt life grow inside of me and die inside of me. I mourn the children that I have that were never born. I do believe that life begins when an egg is fertilized by a sperm and is implanted in the womb. However, I do not believe life is the same as personhood. Personhood is what we're here to discuss today, isn't it? Does an embryo, a zygote, or a fetus have the same rights as the woman carrying it? As an IVF patient, should I be forced to keep my embryos in cold storage because if I transfer them to my womb, they may be miscarried? Would a miscarriage really be murder? Are we seriously implying that in 2025? What about the long-term consequences to the already log-jammed criminal justice system if we accept this asinine rhetoric? To those A-plus SBA politicians, I have a suggestion. Beware the unintended consequences of your zealous crusade to reestablish abortion bans. The unintended consequences will have devastating economic consequences throughout every facet of the taxpayers' lives, taxpayers that keep you employed. 2006 was the first time I was pregnant. I wanted to keep my baby. I had named my baby Lucy. I miscarried. My OBGYN, unknown to me at the time, was a member of a professional organization for pro-life doctors. She refused to treat my miscarriage. She refused to see me while I was still bleeding. She refused to refer me to another doctor. In fact, she went as far as to cancel the appointment that I made with another provider at that clinic. When asked what would happen if I went to the ER, I was told that my OBGYN would be called and I would be discharged. I had an incomplete miscarriage. I bled for weeks, from March 17th until mid-May. Giant clots, bleeding through at least a pad an hour at times. I was so weak I often couldn't get out of bed. I called my OBGYN and begged for help, a DNC, medication, anything. I was met with hostility and told not to call again until I was no longer bleeding. I could have died because of a pro-life OBGYN. These are the same doctors that advise the GOP and support abortion bans. They don't care about their patients. They don't care if we live or die. Mine certainly didn't. I was barely 19 years old at the time. In 2008, I had my son, a beautiful baby boy. The people in my life, my mother, the man that had impregnated me, tried to pressure me into an abortion. I stood my ground and I thank God every day that I did. Being pro-choice doesn't mean aborting every pregnancy. It means mind your own damn business. In 2024, I married the love of my life. He was an anti-choice, Scalia-loving Roman Catholic Reagan Republican. I know, it's weird. It's real weird. In his mind, abortion was a mortal sin, and Roe should be overturned. We had that argument so many times until we needed an abortion. After years of struggling with infertility and the costly invasive infertility treatments, we conceived naturally in 2021. His name was Oliver. A mother knows when something isn't right. The entire pregnancy, I felt as though something was off, so we tested. We did the early ultrasounds at 8 weeks, 12 weeks, and 15 weeks. We did the genetic testing at 10 weeks. Everything looked normal, no abnormal results, but something still felt off, so I insisted we do an autonomy ultrasound prior to 20 weeks. 20 weeks is kind of the standard for anatomy ultrasounds. 20 weeks to see if the baby had all of his parts, organs, everything is functioning as it should. Only 9 states and the District of Columbia have no gestational age restriction on abortion. In Wisconsin in 2021, Wisconsin's gestational restriction was 20 weeks. We had our anatomy ultrasound at 18 weeks, but Oliver was uncooperative, or so we thought. We had to come back in a week to finish the anatomy ultrasound. As we got started with the second anatomy ultrasound, Oliver again appeared uncooperative. After 5 minutes of trying, the ultrasound tech went silent and left the room. Looking back, she could see right away that there were problems with the spine, heart, and kidneys. She just couldn't tell us that in her position. We were sent to a facility 90 minutes away from our home at 19 weeks, 6 days, to do a level 2 ultrasound and a fetal echocardiogram because our rural clinics don't have access to that specialized equipment. It was here that we learned the full extent of Oliver's problems. Starting at the top and working our way down. He had severe scoliosis and deformed vertebrae in his cervical and thoracic spine, which is likely why we never felt him kick or move his arms. He was paralyzed, likely due to interference with his spinal cord development. He had a large VSD, which is a hole in his heart, that would likely require surgery before his first birthday. During his echo, when we looked at the blood pumping in his tiny heart, it looked like a sponge being wrung out, not pumped through. He was missing a kidney, and the kidney that did develop was extremely undersized. He needed dialysis and a kidney transplant. He had deformed feet, known as rocker bottom feet, which would also need surgery. Additionally, he was having fetal seizures, which never has a good outcome and showing signs of failure to thrive. If our baby made it to delivery, he would have a horrible, prolonged death. And we would bankrupt ourselves financially, mentally, and emotionally to try to make Oliver's only moments with us less physically painful for him. We made the choice as Oliver's parents that we could not let him suffer, that it would be better for all of us, Oliver included, if we provided him with a good death, a quick death, before his brain had a chance to develop pain receptors. Oliver would never know pain, discomfort, hunger, cold, loneliness, or fear. His death was quick, painless. He was warm, fed, comforted inside of my womb, possibly hearing my heartbeat, my heart break. We couldn't offer Oliver a good life, so we gave him the only mercy we could, a good death. Fetal death was quick, a shot of digoxin to the heart, and he was gone in seconds. The next day, he was surgically removed from my body. We had to leave our home, our community, our state to receive medical care. If I could not access abortion care, I was prepared to kill myself to prevent my son's suffering. I was a high-risk pregnancy due to my own medically complex diagnoses. Due to my weakened immune system, I went septic after my abortion and nearly died. My organs were starting to shut down, and there was talk of being put on a ventilator. I firmly believe that had I been able to access care in my own community with my own care team that was more personally familiar with my situation, this never would have happened. Oftentimes, the people that talk about abortion don't truly understand what they're talking about. It's a distant, hypothetical thought experiment. For those of us that have lived it, the stripping of our rights, the shame placed on us, the fear of prison, lawsuits, and even death from zealots is very real. Look at Dr. David Gunn, Dr. George Tiller, and even the Hortmans and the Hoffmans earlier this month. We recognize how the Dobbs decision was just the beginning, how Dobbs is stripping away our rights by design, allowing Republicans a clear path to a national abortion ban. Shame on Republican lawmakers for even suggesting that because I did the right thing for my son Oliver, I should be imprisoned, or, according to some politicians, even put to death. Shame on them for attempting to criminalize abortion and miscarriage. And shame on the American people for allowing this. My plea today is that you fight government overreach and interference, and you let mothers be mothers. We know what's best for our children, our families, and ourselves. Thank you.
you, Heather, for your willingness to share your very personal story with us. Thank you so much.
Thank you, ma'am.
First, I'd like to thank the Democratic Women's Caucus and Reproductive Freedom Caucus for joining with Steering and Policy to put on this important hearing. As you've heard, 3 years ago, the Supreme Court overturned Roe v. Wade and set off a series of dangerous actions by Republican lawmakers at every level of government attacking women's reproductive rights. Republican-led states like Texas, Indiana, and Tennessee have advanced cruel abortion bans. They are restricting access to abortion care and criminalizing healthcare providers, leading to poor health outcomes for women and even death in the worst of cases. I am committed to ensure that women can access the care they need and that healthcare providers such as Dr. Kara C. Huger, is that correct? Huger can provide this care. Dr. Kara Huger is a maternal fetal medicine specialist based in Salt Lake City, Utah. She serves as associate professor in the Department of Obstetrics and Gynecology at the University of Utah Health Sciences Center and is an attending physician at Intermountain Medical Center. She is a board-certified obstetrician, gynecologist with subspecialty board certifications in both maternal fetal medicine and complex family planning. Thank you so much for being here today. And I'm now turning it over to you for your opening statement. You have 3 minutes. Thank you.
Good morning, members of the Democratic Women's Caucus, Reproductive Freedom Caucus, and House Democratic Caucus. Thank you for the opportunity to speak on a topic that is so close to my heart. My name is Dr. Kara Huger, and I'm a board-certified obstetrician and gynecologist with subspecialty board certifications in both maternal fetal medicine and complex family planning. This means that I work with patients who have complicated pregnancies, and I provide complicated abortion and contraceptive care. I am a member of the Society for Maternal Fetal Medicine, where I serve on the Health Policy and Advocacy Committee. Helping women and families have healthy pregnancies is my life's work. I'm a mother myself, and since completing my fellowship over a decade ago, it has been my very great privilege to serve the women and families of my community through countless pregnancies and joyful births. But not every pregnancy is joyful. Some are sad or scary, and it is no less a privilege to be with patients during those more difficult times. I'd like to provide a glimpse into what abortion care restrictions mean for real people. Shortly after the Dobbs decision, a patient traveled to me from a neighboring state that is one of the strictest abortion bans in the nation. At a routine ultrasound done at 20 weeks of gestation, they had learned of a fetal condition that was so severe that there was little chance of long-term survival. Because of the very strict abortion bans in their state, their only option would have been to continue the pregnancy for another 5 months and give birth to a baby that would die during labor or shortly thereafter. I spent hours with this family, talking over all of the options, including the choice to continue the pregnancy, which some people choose and which we fully support, or to end the pregnancy early through abortion care, thereby preventing any potential future complications to the patient's health and allowing her and her family to move forward with the grieving process. Ultimately, this family chose abortion care, which I provided. It was peaceful. The parents held and honored the baby after delivery, and we helped make mementos. As I was getting ready to leave the room, the father said something I'll never forget. He said, "You know, doctor, I've always been staunchly pro-life. I guess it's easy to be against abortions until you need one." I choose this example not because it is rare and exceptional, but because it isn't. Pregnancy is a significant life event. For almost all of my patients, the decision to continue or end a pregnancy is a significant one, but not a political one. And I want to emphasize this. The reasons people need abortion care are as varied as the reasons people choose to have children. We often hear about moral objections to certain types of health care. We rarely hear about the moral obligation to provide care, and yet I and every doctor I know that provides abortion care do this work because after thousands of patient encounters, we have come to understand that abortion care is essential. When I chose my career, I certainly never foresaw that fulfilling my oath to provide ethical medical care would necessitate congressional testimony. But my heart breaks every day when I see the ways in which abortion care restrictions are actively causing profound and irreparable harm. Women and families are better suited to make complex decisions about their own lives than our 50 different state legislatures or any government body, whether that is to continue a pregnancy or to end an undesired, mistimed, or complicated pregnancy. So on behalf of patients in my care, on colleagues who are struggling to provide ethical care despite these laws, and on behalf of women and families across the country who never thought they'd be faced with such a decision, I urge lawmakers to trust your constituents, to know their own hearts and minds, and to completely remove government from what should be private decisions. Thank you.
First, I want to express my gratitude to Leader Jeffries, Chair Aguilar, our Democratic leadership, which has been steadfast in their commitment, all of our colleagues for convening this hearing today. I'm honored to co-chair the Reproductive Freedom Caucus alongside my dear friend and sister in solidarity, Congresswoman Diana DeGette. I also want to express my gratitude to each of our witnesses. When hashtags have faded and headlines disappeared and focus is, people are just less concerned. They're just digress for a moment and say it's why we need to pass the ERA. That people would be complicit in normalizing the second-class status of women in this country. So we need to pass the ERA. I also want to say, Heather, thank you for your candor. Thank you for bringing Oliver and Lucy into the room. I very much look forward to a day where people do not have to relive their traumas in order to compel action from their government. But for so long as that is the case, we are exceedingly grateful for your willingness to do so. But again, to each one of our witnesses, thank you for standing in the gap in defense of our freedoms. Thank you for being a source of strength, hope, and inspiration, for being a lifeline to people who are, from providers to prescribers to patients, or who are living in fear and carrying, more often than not, a shame that is not theirs to carry, because the shame is not in seeking abortion care. People who seek abortion care are people you worship with, people you work with, people you live with, people you love. The only shame is that there are calloused, ignorant individuals who seek to deny our full freedoms and bodily autonomy, who are working overtime to deny you that which is a fundamental right, and that is health care. Again, 3 years ago, the Supreme Court denied us our bodily autonomy and ripped away the fundamental right to abortion care in this country. Since that cruel decision, we've witnessed devastating and deadly consequences for patients across the nation. Abortion bans are denying families basic medical care. And the Black maternal health crisis only continues to worsen. My paternal grandmother, Carrie, who I have a picture of on my ancestor wall to inform my why each day I never had the privilege of meeting. She died in the 1950s, giving birth to my uncle, my father's youngest brother. And the fact that in 2025 that black women are still 3 to 4 times more likely to die in childbirth or post-birthing complications, and that crisis is worsening in the midst of this extremist march towards a nation of forced birth. You know, everyone at this table has been a canary in the coal mine. And it is devastating and heartbreaking that everything that we predicted would come to pass with the fall of Roe has happened, and then some. And when it comes to the black maternal health crisis worsening, the pain of black women dismissed as black people and seen only as black bodies continues to worsen. Republicans' attacks on our basic reproductive freedoms are a risk to every person who calls this country home, and have disproportionately impacted our black, brown, immigrant, disabled, and LGBTQ+ communities. And now we face a hostile administration doubling down on ripping away essential health care. Trump and Republicans are pushing their big ugly bill, cruel legislation that would destroy Medicaid, as we know, which covers 50% of births in this country, defund Planned Parenthood health centers, ban abortion coverage in private insurance plans on the ACA marketplace, and put essential care further out of reach for millions. Actions void of both common sense and compassion, actions initiated overwhelmingly by men, overwhelmingly by white men. This unjust and worsening status quo is not an inevitability. Today we recommit not only to protecting and defending reproductive health care, but to advancing an affirmative vision for a just America where abortion justice is realized and everyone, no matter their zip code, income, or immigration status, can access the care they need with dignity in their own community. That means stopping the Republicans' reconciliation bill in its tracks and advancing comprehensive legislation at every level of government to protect and expand abortion access and to affirm our fundamental rights. My daughter is turning 17 in a couple of days, and as we begin to consider where she will pursue her higher learning, a key factor is where she will be able to access health care. The other day she asked me, are we going to be okay? And it is becoming harder and harder to answer that question. But I will say that each of you here strengthened my resolve when I'm tempted to question, how much worse can it get? How much lower can they go? When I look at you and I listen to you and I sit shoulder to shoulder with my colleagues, instead I say, how hard can we fight? And with that in mind, as I think about how hard we can fight, and someone who is a personal shero of mine, it is my honor to introduce our sister legislator from the great state of Tennessee, Senator London Lamar. Senator Lamar has been a passionate advocate for improving maternal and infant health outcomes, particularly addressing the systemic inequities that disproportionately impact Black mothers. In her very first legislative session, she introduced Senate Bill 2150, which tasked the Tennessee Department of Health and Care with studying doula certification programs and developing policy recommendations aimed at enhancing maternal and infant health across the state. The bill passed the Senate unanimously, marking a critical step toward integrating doula services into Tennessee's healthcare framework. Senator Lamar championed the Tennessee Momnibus, a comprehensive package of maternal health legislation designed to tackle a broad range of barriers faced by mothers. The Momnibus includes provisions to expand doula services for incarcerated women, establish state licensure for doulas, and provide grants to support mothers returning to work. These efforts reflect her commitment to ensuring that all mothers receive the care and support necessary throughout their reproductive journeys. For Senator Lamar, this work is both deeply personal and about systemic injustice. Senator, the floor is yours.
Thank you so much, Congresswoman. And Madam Chairs, to Democratic leadership, members of Congress, and this caucus, thank you for the opportunity to testify at this critical moment in our nation's history. My name is Senator Lundy Lamar, and I proudly represent Tennessee's 33rd Senate District and serve as chair of our Senate Democratic Caucus. I also sit before you as the youngest woman and the youngest African-American ever elected in Tennessee Senate history, in addition to being the first sitting senator to give birth while serving. Thank you. Thank you. I'm here not just as a lawmaker, but as a mother of a 1-year-old and a Black woman from Memphis who has seen, lived, and experienced and grieved the consequences of a broken maternal health system and a cruel, unjust abortion ban. In October of 2019, at 32 weeks pregnant, I had an abruption, and I experienced a stillbirth, in addition to I almost died from stroking out as a result of preeclampsia during my first year as a legislator. It was the most painful experience of my life, physically, emotionally, spiritually. I had to navigate deep personal grief while carrying the weight of public service, just like all of you today. That tragedy became my purpose. And after having to bury my first baby at 28 years old, I committed myself to fight for a world where women, especially Black women, have the right to quality care, support, and the power to choose motherhood freely and safely. But this fight started before my own loss. And in December of 2015, I had to claim my cousin's body due to pregnancy complications. Her doctors advised her to seek an abortion because continuing the pregnancy would put her life at risk. But because of stigma, barriers, and delayed access, she didn't make it. At 8 months pregnant herself, both she and her baby died. It was preventable. And yet, under Tennessee's abortion ban, her story could be the story of many women today. So what's the reality in Tennessee? Tennessee has a near total abortion ban with no exceptions for rape, incest, or fatal fetal anomalies. Even medical emergencies are treated with suspicion, forcing doctors to weigh between their license and patients to risk their own lives. Meanwhile, Tennessee has the highest maternal mortality rate in the country. And Black women like my cousin die from pregnancy-related causes at nearly 3 times the rate as white women. And nearly 80% of the deaths are preventable in Tennessee. And yet we are met with silence from those in power unless it is to push a forced birth agenda without support. So I have been fighting at the state level and have introduced legislation to expand postpartum Medicaid coverage, reimburse doulas under TennCare, invest in maternal mental health. But at every term, extremist lawmakers block our efforts while ignoring housing, childcare, and economic needs that actually help families thrive. I recently visited Brazil with some other state lawmakers, the State Innovation Exchange, and the Women's Equality Center, a country where they also, too, have an abortion ban, but they still allow exceptions for rape, incest, sexual violence, and medical necessities. More importantly, it offers universal access to free healthcare. Women there are at least not left to suffer alone. It reminded me that even with restrictions, national policy can still protect dignity and access. But in Tennessee, they've taken our rights and left us nothing in return. And that is why Congress must act. What we need from you, we need federal legislation to restore abortion rights nationwide, like the Women's Healthcare Protection Act. We need full federal investment in maternal health, prenatal care, and postpartum support. We need policies that hold states like Tennessee accountable, ensuring that they are met with national standards of reproductive care or risk losing their federal funding. So to the chairs and my colleagues, No woman should have to die because of politics. No family should have to bury a loved one due to preventable complications. Reproductive freedom is not just about choice, it's about survival. Today, as a mother who lost a child and as a cousin who watched another one die just tirelessly, I urge you to act. Restore the rights to Dobbs. Restore the right to abortion. Pass laws that we cannot pass ourselves in states like Tennessee. And help us build a future where every mother is chosen and not forced to give birth. Thank you.
Thank you very much, Senator Lamar, and thank you to each of us. You brought tears to our eyes, but purpose to our heart. And with that, I would like to now recognize a wonderful leader. She's been a champion. She motivates all of us in the full range of issues affecting women and families. Chair Pippa Clark.
Thank you so much, Teresa. And Senator Lamar, thank you. I want to thank all the witnesses for being here and for your work, but thank you for taking really, as a mom of three, unimaginable grief and turning it into the purpose that you have. And you inspire us. And I don't think we could be more determined, but you just made us more determined. And we appreciate that. That is not an easy story to tell, but it is one that way too many women in this country are facing. And it's going in the wrong direction because of what we're seeing our colleagues and this president do. And it's state houses, it's here in the House of Representatives. And we are so grateful to each and every one of you for not only being here, but for the work that you're doing. And to my incredible colleagues who are on a mission to restore full reproductive freedom. And as I look across the aisle, the agenda is staggering. It is staggering to women in this country and to families. It is so disconnected from reality. I read an article recently that one of the favorite MAGA influencers is actually targeting young women to go out and advocate that they get a MRS degree. That their answer is to throw away birth control, and I guess we can take some slim optimism that they at least are planning on having birth control still be available to people, but throw that away and become moms, find a husband and get married. And we would love women to have a full range of options for what they want to do as moms, whether that is staying home, pursuing a career. But the fact of the matter is, work isn't optional for most people in this country. And we underpay women. We don't give them support like childcare that's affordable, that they have paid leave from their job. We overcharge them, and now we're going to tell them that getting an education is a hobby and that work is optional. And then if you fulfill their dream of becoming a mom, as you just laid out, they are going after and systematically dismantling women's health care in this country. And what we're seeing this week over in the Senate, already having done it here in the House, they are gutting Medicare. They're gutting Medicaid, and they're shutting down hospitals around this country. And nursing homes will go with it too. And you know who will have to take that aging parent who's in a nursing home back into their home? Women. Women who are already not making it. So if it isn't bad enough out there, as you said, in states like Tennessee that have strict abortion bans, 35% of counties throughout the country don't have a single OBGYN to have a safe place to have a baby. In states like Tennessee, in particular Georgia, that's 50% of all counties have no place to have a ban. And now with their big ugly bill, they want to drive those numbers higher because Medicaid covers 40% of all births in this country, and you take that away, we hear the message. And when they say they want to protect women, they oppose anything that is remotely pro-family or pro-woman. And they wonder out loud, why aren't women having more babies? Why is this not going the way we see? Maybe if we give them $5,000, that'll do the trick. But we're going to take away their health insurance. We're going to take food off their table with food programs. We're going to say to our women veterans, you don't count. And thank you for standing up for our country. Thank you for putting your life on the line. Now we're going to tell you what your health care options are, and they're grim. And then they're hiking prices of the basics when 60% of families in this country are not making it. And they're defunding public schools, Head Start, and even Sesame Street. So I just thank you again. Thank you for your work. Alexis, I have a question for you. Millions of women are living in medical deserts. And we know that defunding Planned Parenthood, many of these clinics are in places that are underserved already. What happens to these patients when all of your clinics are threatened, but 200 of them are looking at closure? And I see a giant sign that my time has expired, but so if you could answer briefly, sorry for, the senator got me riled up, so.
We are all riled up. And as I understand, the Medina decision came down, so we are waiting to hear that as well. What happens when 200 health centers close that are largely in rural areas, right? And Planned Parenthood is the first point of entry into the healthcare system generally. It means that people will delay or forgo care, right? Or will have to find a way to travel hours in order to get access to that care. And the consequences, are can be deadly, right? If you delay getting access to a cancer screening or, as I mentioned earlier, an STI test treated, that can have a long-term impact on your infertility. And we have seen already the impact of many patients since COVID through now who just kind of have lost connection to their sexual and reproductive health care because of the circumstances of getting access to what it was supposed to be essential care. So it does not mean that care is not needed. It means that it is delayed or forgone.
Thank you. I apologize to the co-chairs for throwing your timing off, and thank you all again for being here.
Thank you to Whip Clark, and thank you to all of our witnesses for being here today. As the co-chair of Steering and Policy Committee, I'm grateful to you for sharing your deeply personal stories and your professional experiences to uplift the importance of reproductive freedom. When a woman's access to reproductive health care is taken away, her life is at risk. Dr. Huser, my question is going to be to you. In a Wall Street Journal article this week, one of our Republican colleagues of Florida blamed Democrats for doctors hesitating to treat ectopic pregnancy last year because of the state's 6-week abortion ban. Many women in states with strict abortion bans do not receive the care they need. In the article, my colleague claims that the left is scaring medical professionals with messaging that implies they could face criminal charges for providing reproductive care. This is false. In reality, it was Florida's vaguely worded law that caused doctors' hesitation. So, doctor, as a board-certified OBGYN, you provide abortion care in Utah, a state with an 18-week abortion ban. Can you describe how the threat of criminal charges for providing abortion care has changed for doctors in Utah after Roe versus Wade was overturned?
For that question. Immediately after the Dobbs decision, our laws in Utah changed about 6 times in 5 days. So not only were the laws vague and confusing, but they were shifting sands all the time. We have a 6-week abortion ban that is currently in the court system. And that was in place for some time. I get calls from colleagues across the state when faced with patients who need urgent care, but there's still fetal cardiac activity, asking me, is this care I can provide? Am I going to go to jail? Unfortunately, the Trump administration recently rescinded the guidance to follow EMTALA in these cases. So we've seen, especially in Idaho, that even situations in which the woman's health is at immediate risk, people cannot provide care without risking both their license and becoming felons. And that's very sobering. So these bans are harmful. They lead directly to maternal complications, morbidity, and mortality. And I cannot emphasize the ways in which allowing women and families to make these decisions on their own is life-saving.
Thank you. I yield back.
I'd like to now recognize Representative Fouché for 3 minutes.
Thank you to the Steering and Policy Committee, the Democratic Women's Caucus, and the Reproductive Freedom Caucus for holding this timely, important hearing today. In my state, we've already seen how the North Carolina General Assembly left thousands of individuals without the care they needed after they enacted a strict 12-week abortion ban. This has been particularly devastating for the LGBTQ plus Americans who, outside of broader attacks on their community, are already more likely to report being harassed or outright denied service when seeking the reproductive care that they need. So, Dr. Huser, to you again, given this unfortunate reality, what are some practical steps that providers can take to build trust with the LGBTQ plus patients and ensure them that reproductive health care services are accessible?
I think interacting with the communities that we serve in all ways is vitally important. And treating each patient that comes to us as an individual, regardless of their background, is part of the ethics of medicine. All patients, all people should feel welcome and heard and supported when they seek medical care. And we haven't always done a great job of that in the medical community. And I think we are trying to do better. We're not where we need to be yet, but we are moving in a good direction. And so I think that the efforts that are going on right now to engage both LGBTQ folks, Black mothers, and help people feel like they can be heard and comfortable with their physicians, and that we have their best interests at heart, are absolutely vital.
Thank you, Madam Chair. I yield.
Representative Ross for 3 minutes.
Thank you again to the Steering and Policy Committee, the Democratic Women's Caucus, and the Reproductive Freedom Caucus for holding this timely and crucial hearing today. And of course, to the folks who have come and told their stories, as you can tell, you've really, really affected us. So Tuesday marked the 3rd anniversary of the Dobbs v. Jackson decision, a dangerous reversal of Roe versus Wade that has devastated the landscape of reproductive rights and threatens the safety of women and families across the United States. Unfortunately, because of right-wing extremists in state legislatures, we've seen countless attacks on critical abortion care nationwide, including in North Carolina, as my colleague referenced. Now, doctors are being forced to turn away patients seeking life-saving care, and women may have to travel thousands of miles for the critical care they need, as we heard from Ms. Martell. We are already seeing the impact of these abortion care restrictions on the availability of doctors and doctor trainees. The number of applicants to residency programs in states with abortion bans and limits steadily dropping. The next generation of OBGYNs in states with abortion restrictions or bans are not getting the hands-on training they need to build and maintain their skill sets, which can impact their ability to respond to emergencies and other regular aspects of maternity care like miscarriage management, which again, we heard about. So even if it's legal, women are having difficulty accessing necessary care. And restricting health care combined with fewer accessible trained physicians is an assured recipe for preventable harm and tragedy. Dr. Huser, I'm sorry you're on the spot. Everybody's asking you these questions. As a board-certified OBGYN with subspecialty in board certifications in both maternal fetal medicine and complex family planning, how would limiting hands-on abortion care training have impacted your professional education and your ability to care for your patients?
Yeah, you're absolutely right that legality is not the same as access. And we are seeing trainees coming out of residency programs without, some of the necessary skills to provide abortion care, especially at later gestational ages. Since you asked how it would personally have affected me, I do almost all of the abortions for my large hospital system. And I wouldn't be able to provide that service. I learned how to do this in residency. I had excellent teachers. In fact, the very first time I provided abortion care, I actually felt a little uncomfortable with it. And I went to my attending physician, I was a resident, and I said, well, thanks for teaching me how to do that, but I don't think that's something that I'm gonna provide in my regular practice. And he said, well, do you think women have a right to this procedure? And I said, of course. He's like, well, you might want to think that you have a responsibility to provide it. And that conversation changed the trajectory of my career. And I think we have a responsibility to our trainees and to all of the patients that they are going to be caring for to advocate for access to abortion care, not only because women need it, but because they need to be trained to take the next generation to be able to provide this for patients in the future.
Thank you, and I yield back.
Recognize the sponsor of the Women Health Protection Act, Representative Judy Chu.
Ms. Martell and Dr. Huser, we've seen the devastating consequences of the Dobbs decision play out in states across the country where women are turned away from emergency rooms, left to bleed out until they become septic, and have even died from the lack of care because of state abortion bans that prevent them from getting the necessary medical care they need. House Democrats are fighting back, and earlier this week we introduced my bill, H.R. 12, the Women's Health Protection Act, or WIPA, which would restore the protections of Roe versus Wade in every zip code of this nation. Anti-choice politicians will say that their state-based abortion bans are okay because there are exceptions for the life and health of the mother. But there are so many interpretations of when a woman's life or health is in danger. Is it when she's septic? Is it when her organs fail? Can you tell us why this exception for life and health is so often incomplete for so many women, and how the Women's Health Protection Act would change things for the better?
Exceptions are not the answer. And I would like to push our representatives to actually go even beyond Roe and allow abortion care for anyone who needs it. The reasons people need abortion care, and it is always life-saving, are as varied as individuals. National protections are vital. We cannot have 50 different laws in 50 different states that people are trying to keep track of that also change on a daily basis. So I think what you're doing is important, and the Women's Health Protection Act sounds like a wonderful thing that will really help women. And I would love to see us even go beyond that and take government out of reproductive decisions altogether.
Yeah, Ms. Bartel.
Thank you. From my story, you can see that exceptions don't work. Furthermore, in my state of Wisconsin, exceptions for rape and incest, they also don't work. In the state of Wisconsin, a rapist has parental rights of their child that they father. So it's vital that we are able to access abortion on demand for any reason. Having, as the doctor had said, 50 different rules also brings to my mind issues of interstate commerce laws and how that might be a violation there. Because as we're seeing in Texas, they're trying to prevent women from fleeing the country to have medical care, which is a violation of some of our interstate compacts. And that's not right. That's a breach of our constitutional rights. So just my thoughts on that. Thank you.
Thank you. I yield back. Oh. Yes.
In addition, I would like to also add, I think that your piece of legislation is so vitally important because your ability to live is based on your zip code. And we have taken away a standard of care where I think about myself. And I just had my 1-year-old while Tennessee had its abortion ban in place. And the fear that I had of dying, potentially dying again, was unbearable. It was a fear because I knew that if I had signs of preeclampsia, I could not choose my own life. It would have to be until I'm almost dead, or I'm having another abruption, that the doctor can then say, I'm ready to risk my license in order to save your life. And so for me, when I think about not only should women have the choice with no explanation to seek abortion care, for the women who are scared to go through the pregnancy process, and in states like Tennessee are still forced to go through that, this nationwide reinstatement of abortion rights in your legislation that I'm proud that you champion can give women like my cousin or myself, if I choose to go through this process again, the ability to know that I have a way out that allows me to survive. Thank you.
Thank you.
Thank you. Would now like to recognize my hermana from Nuevo Mexico, Representative Melanie Stansberry.
All right. Well, good morning, everyone. Thank you so much for being here. As it's been said, we're 3 years since the Dobbs decision overturned a half-century of precedent, recognizing the constitutional right of us to control our own bodies. That's what that decision was about. And since then, 19 states have passed laws restricting access to reproductive care. And now Republicans are actively, literally in this House, trying to use reconciliation to defund Planned Parenthood and to ban abortions nationwide using the Affordable Care Act. Let me repeat that. Republicans are trying to pass a national abortion ban right now in Congress. They are trying to do it right now. I think a lot of people don't realize what is happening in this chamber and what is happening in Congress. And that is in addition to all of the other efforts that they're undertaking to take away our health care through Medicaid and now Medicare, through food assistance. They're trying to undermine the judiciary. They're trying to steal our data. They're trying to steal our public lands. And the reason why I'm telling it all together is because it's all in one package. And it's all part of one agenda. And so I want to be clear that these attacks on our bodies are actually part of a larger attack on our democracy, our freedoms, and our rights. And it's un-American. It's toxic, it's abusive, it's dangerous, and it's weird. The weird obsession that our Republican colleagues have with our bodies, whether it's women's bodies or LGBTQ plus bodies, is bizarre. But of course, it's also rooted in history, right? This is the history of America. This is the history of men, primarily in power, trying to exercise control. I think many of us have been in abusive relationships. What are the telltale signs of abusive and toxic relationships? People trying to control your bodies, control what you can do with your life, control your decisions, and decide what and how you can live your life. We are in a toxic relationship with the government who is trying to control our lives. They're trying to tell us what we can do with our bodies. And I can tell you, no matter how you feel about children, about birth, and I think your story bears this out, we can all agree that the most American and patriotic thing that we can do is protect our rights to make decisions about our own bodies. So, I never thought when I ran for office as a woman that I would even have to deal with this issue, to be honest. I'm a science nerd. My background's in water resources. I ran for office because I wanted to work on science. I wanted to work on protecting our natural resources. I wanted to work on economic development, making sure that our communities could thrive. But I never thought that I would end up having to spend my time in public office defending the right of Americans to just make basic decisions about their dignity to live. And in addition to that, I want to say I grew up in a low-income family. I grew up in a family that did not have health insurance. And the first place that I got reproductive care was Planned Parenthood, because the only reproductive care in many low-income communities is Planned Parenthood. And to this day, even as a sitting United States Congresswoman, I still go to Planned Parenthood because it is still the most accessible care in my community. So people who are trying to legislate our bodies, trying to control us, trying to tell us what to do with our bodies, clearly don't understand the implications of it, or maybe they do. Because when I think about what's happening in this chamber and think about what the American experiment and democracy is about, I look at the long arc of history in the last 150 years and the expansion of freedoms and the ability for all of us who are sitting here to even run for office, to vote, to participate in democracy, to make decisions about our bodies. Like literally, that is what the march of history has been about. And we are now here as the Women's Caucus, the largest number of women ever serving in Congress. And I don't think it's any mistake that we're all sitting up here fighting to defend our rights. So I want to say thank you to all of you for being here today, for telling your stories, especially your heart-wrenching story about your personal experience. And thank you for defending our fundamental rights as women. And with that, I yield back.
Thank you. Now we would like to recognize Representative Sarah Jacobs.
Well, thank you. And thank you all so much for being here and for sharing your stories. And, you know, I echo my colleagues in everything they said, and especially in their thanks for you all bearing your trauma so that we can make policy change. It shouldn't have to be this way, but those personal stories really are what change things. So one of the things I want to highlight is that while in many ways this fight feels the same, it's actually very different than the fight our mothers and our grandmothers had to fight. Like you, Senator Lamar, I am one of the youngest members of this body, and as a proud millennial, our generation and the ones younger than us, we do everything online, right? We buy groceries online, we shop online, we talk to our family and friends online, we access research and research our healthcare online. And our abortion care isn't any different, right? People are Googling how to obtain an abortion for themselves or their friends. They're ordering abortion pills online. They're using Uber to travel to the abortion clinic. They use period and fertility tracking apps like I do. And unfortunately, all of that information is unprotected, and it can and already has been weaponized against us because none of that information is protected by HIPAA. And unlike in the pre-Roe era, we have this huge unregulated data surveillance state that collects, tracks, analyzes, and shares personal information about us. So Alexis, I was hoping you could talk about why it's so important that we protect this kind of data, especially in states that have criminalized or otherwise restricted abortion care.
I mean, I think you captured it quite eloquently. And as someone who spends a lot of time thinking about how to access information online, particularly with new algorithms, with AI, this challenge is growing even greater than our ability to catch up to it, right? And it also is built into the way in which lawmakers, even without data or without technology, have also sought to surveil our patients, right? So not too long ago in Missouri, the state health commissioner was actually tracking the periods of Planned Parenthood patients in order to see whether or not they were following through with their pregnancies. That kind of evasion has been around for quite some time. And then you layer on technology and a deep connection to many technology firms that are becoming closer with this administration and government. The deregulation that is happening is going to happen at the expense of our bodies. The challenge is that you will create more criminalization, more fear of criminalization and seeking access to care, whether that is crossing state lines, whether that is the information that you share with people. All of that is going to redound to the stigmatizing, the shame, the delaying, the foregoing of treatment, and just the general fear that undermines healthcare generally. What we've heard from our provider at the table, and our patient storyteller is that the currency of healthcare is trust. And when you cannot trust that your information is going to be treated privately and that you have the ability to make those decisions for yourself, you are limited in your ability to get that access.
Thank you all again for being here.
So I'd like to now recognize another millennial, Representative Sarah McBride.
Thank you very much, and thank you so much to our witnesses for your patience and your perseverance every day, but particularly through this hearing. I believe I'm the final person as a freshman in this spot to ask some questions, but thank you so much to my colleagues for bringing us together for this critical conversation. As we gather here, we should be clear. The Republican agenda is not pro-life, it's not pro-family, and it's certainly not pro-freedom. Because if it were, Republicans wouldn't be forcing women to flee their home states just to access basic reproductive care or threatening IVF and contraception. And they certainly wouldn't be criminalizing doctors for providing life-saving care. Instead of protecting care, they've made it more expensive, more dangerous, and more out of reach for everyday families. And they've done it all while refusing to bring any meaningful legislation to the floor to make parenting easier and more affordable. No national paid family and medical leave. No guaranteed prenatal or postpartum care. No affordable child care. Rather, they're pushing through a disastrous budget that will gut Medicaid, a lifeline that covers 41% of births in this country. Heather, your story was so powerful, and it lays it out very clearly. You were denied life-saving abortion care in your home state when you were pregnant. You had to go to another state. But my understanding is that the challenges and the costs that you have faced in building a family through the years, they don't end there. That's not freedom. Having to leave your state to get care, having to pay large sums out of pocket, that's not freedom. That's not family values. That's cruelty. It's abandonment. And to my colleague's point, it's control. This is about control. We're told again and again that these policies are about protecting life. But if that were true, we would see investments in policies that actually help people live and start a family and raise kids. Instead, we see burdens, we see bans, and we see barriers. And so, Heather, my question for you, and like I said, you've been so courageous, and I also want to say, you not only represent your family so powerfully, you also represent your community so beautifully. My late husband, Andrew Cray, was from Chippewa Falls, and so I thank you for your service to that community and for being with us. But you shared your story so powerfully, and obviously in our bio, we can read a little bit more about your family's journey. And I hate to talk about costs and particularly an individual family's out-of-pocket expenses. But I'm wondering if you could share how much your family has had to spend out of pocket for the full range of reproductive care that you have had to obtain throughout all of your pregnancies, and that includes travel costs too. And so I'm wondering if you could share for us what kind of costs your family has faced.
Thank you. Now I don't have exact numbers for you, so just kind of ballparking, starting with the abortion. We were quite lucky. Our abortion was $3,000 to $3,500. That was just the procedure. They needed cash up front. We were lucky in that Planned Parenthood offered us a grant that covered about half of it. Without that grant, we wouldn't have been able to afford any of it. We received further assistance from an organization called Options Fund of Eau Claire, and they provide grants and loans to people meeting their income requirements in order to obtain abortion care. So we were able to take out a loan with them because having, $3,000, $3,500 on hand that isn't earmarked for your mortgage or your insurance payment or your car payment is just not realistic in the world that we live in. So Option Fund helped us, so we only had to pay $1,000, $1,500 up front, and that was a bit more manageable for us now. I have a very good job as a legal assistant. My husband, he's a partner at a law firm, so we're upper middle class people. We could afford this. Not everyone could. 20 years ago, I would not have been able to afford this. And this is pre-COVID dollars too. Just want to lay that out there. So in our abortion, we were very lucky. We live, Chippewa Falls is about 90 minutes away from the city of St. Paul where we had the abortion. So again, we were very lucky to be that close. Again, just a whole lot of dumb luck in all of this. So it was basically a tank of gas to get there. Because it was a 2-day procedure, it was there and back both nights. Because we were so close, we were able to do that, travel back and forth. So we didn't have to find childcare. We didn't have to find a hotel. We didn't have those added extra logistical costs associated that nobody ever thinks of. When we were there, you're there for 8 hours each day, so you have the cost of food while you're there. That's another expense that you don't think of. You have to have a driver. So if my husband weren't able to drive me there, I would have had to pay a service to come and get me and drive me to a hotel room. All of those small expenses do add up very quickly. With the post-abortion, I became septic, and that was easily tens of thousands of dollars that my insurance company refused to pay because the service was deemed unnecessary. My insurance company, I was literally on my deathbed. My organs were starting to shut down, and they were talking ventilator when my insurance company faxed a letter over to the hospital and the financial department came to see me to tell me, we're not covering you. Here's the bill. I tell you, that's the only reason I'm here today. Survived out of spite, because I was going to sue my insurance company. You could not imagine. But that's tens of thousands of dollars. And had I not been in the legal field, I wouldn't have known that that was even an option. When I was 19 years old, suffering from a miscarriage, I did not know that I had legal recourse. So now, as a grown adult with a little bit more knowledge in my brain, I understood this, but not everybody has that same experience. Not everybody has that knowledge. So they would have been out tens of thousands of dollars, possibly even hundreds of thousands of dollars, because let's be real, different hospitals offer different services and charge differently. If we're looking at the medical care that I received prior to the abortion, the needing the two doctors to verify incompatible with life diagnoses, we had specialists, we had maternal fetal medicine doctors, we had hundreds of thousands of dollars just to confirm, just to get to that point where, yes, you can have an abortion, you should have an abortion. Our insurance company didn't want to cover a lot of that too. They would cover the removal of the amniotic fluid for the amniocentesis, but not the testing. So we had to fight for that too. I mean, all of these steps that are nonsense, that our anti-choice politicians are making us jump through these hurdles, jump through these hoops in order just to receive very basic care, costs us so much money. And now to basically give the insurance companies free rein on this and say, you don't have to cover abortion. You don't have to cover things associated with abortion. We could have been facing bankruptcy. And I don't know how many lawyers we have in the room, but you can't file bankruptcy when you're a lawyer. That's not allowed. It's against the rules. So it's, you know, hundreds of thousands of dollars. That's just to get to the abortion. If we look at miscarriage management, you're in the same boat. And having a baby, my son was not a cheap labor either. So you include all of these expenses. It's insane. And our IVF journey, we went to 3 different clinics before, again, we got lucky. Our first 2 wanted between $28,000 and $32,000. We found one further away that's $6,000.
Thank you so much, Heather, for sharing that. And Senator London Lamar, you had similar experiences with cost. We have come close to time, and I wanted to give you just a quick moment to be able to reflect and answer some of the thoughts you had here. And then we wanted to go, I will turn it over to our representative to get, because just so the audience knows, the Supreme Court did come down on the wrong side of history with regards to the Medina v. Planned Parenthood decision. But real quickly, Senator, if you wanted to respond to some of the issues that you've heard today.
Yes, thank you for the opportunity. In addition to what you just said, the costs are just unbearable. But now living in Tennessee, in a state where you're forced to have a baby, and you may not have insurance coverage, you have to find that money if TennCare doesn't cover you. And that's if you meet the criteria. And now with it being a block grant program, when the money runs out, the money runs out. But for me, as a legislator, we have the privilege of having good insurance. But still, I had to pay high cost. Every time I had a scare to go check my blood pressure or it was spiking, that was $1,700 hospital visit, and that's after insurance. When I think about having a stillbirth, we had to find the money to bury my child. So that was thousands of dollars that I didn't have. And at the time, as a legislator making only $30,000 a year, and I didn't have another job, my mama had to find that money, and my colleagues raised money to help me bury my child. So we don't even think about that even if after the fact, there's no funding or coverage for funeral service or burial services for children who did not make it, so that you can bury your child with some dignity. And so even with the best healthcare insurance in the state, every time I went to the hospital having a scare, it was thousands of dollars, and I still haven't paid off my hospital bill. And so even in positions of privilege, we are still burdened with the cost of health care and having children, or even the cost that you have to bear from losing your child.
That is a perfect segue.
That's
to
it.
that.
Yeah.
To get.
Well, several of our colleagues and our witnesses. First of all, let me thank everybody. This was really a powerful, powerful panel. And as we were sitting here, several of our colleagues and the witnesses talked about the multitude of ways that the Republicans in Congress and in our states are trying to restrict health care for women. And it's everything from family planning to abortion care to wellness care. And so while we were sitting here this morning, we were informed that the Supreme Court has decided this case, Medina versus Planned Parenthood, Planned Parenthood South Atlantic, on a 6-3 decision. And I'm not a millennial, so it's really difficult for me to read a Supreme Court decision on my cell phone. But I was trying to read it, and I think that the impact of this, basically what happened was South Carolina said that people could not get their Medicaid health care through Planned Parenthood, and somebody sued, and the Supreme Court didn't let them bring the suit. But I'd like to have Alexis talk about that decision and what that's going to mean for access for women to have health care of all kinds, not just abortion care.
Thank you for the opportunity, Congresswoman DeGette. And I'm honestly trying to contain my rage in this moment, because it so much mirrors, this decision so much mirrors what your colleagues on the other side of the House are trying to do, effectively letting lawmakers weaponize Medicaid, insurance, and pick their providers for them. So what this decision means is that people no longer have the dignity to pick their own providers like Planned Parenthood, to take the insurance that they are able to get because of their income, and go to the providers that they believe are best suited to care for them. So the Supreme Court decided that Governor McMaster, a state that has a 6-week abortion ban, a set of lawmakers that have already voted against the freedom of women, that it is okay to effectively defund Planned Parenthood, and the consequences of this decision are not going to be limited to Planned Parenthood, nor are they going to be limited to South Carolina. They are going to allow states across this country to remove Planned Parenthood's ability to reimburse, like any other provider, Medicaid, to provide the services that they provide every day. So it is outrageous that we are facing both attacks from our nation's highest court that should be there to protect our freedoms, and from your congressional colleagues on the other side of the aisle. And I just have to say, I mean, in what world, right, can we call ourselves a free nation when women aren't free? When you deny us our ability to use our insurance to get access to care, it means we are further away from being realized citizens of this country.
Okay, but I just want to follow up on that. How many women in America get their Medicaid health care paid for through Planned Parenthood?
Half of all of our patients, so 1 million patients, may not be able to get access to Planned Parenthood if, in addition to this Supreme Court ruling, this big bad betrayal of a bill also defunds Planned Parenthood.
Thank you so very much. As a past board member of Planned Parenthood in Peoria, Illinois, and on behalf of the Steering and Policy Committee, the Women's Caucus, and the Reproductive Freedom Caucus, thank you guys so much for all of your testimony, for taking the time to come here and know that you have people that have your back and are fighting for you. Now, I'll get